So I think in the last section we I heard somebody mention SARS-CoV-1 and how public health measures really helped stop that pandemic. So I think it's a
Absolutely.
powerful reminder that vaccination is one important piece of a even bigger toolkit. And even with, you know, the rapid breakthroughs that we've seen and lived through with respect to biotech, where you can sequence and build a vaccine quicker than ever before, still in the early days of an outbreak, we rely on the critical and sometimes invisible work of public health professionals, right? And that hits close to home. All of us have family members who are nurses, doctors, and other types of professionals. So I would love to end on the role of healthcare workers and the community. Maybe I'll first start with Dr. Luber. You had mentioned that your wife was the lead nurse at a school, I think, and how I remember this from my mom. Nurses were often the defenders of immunization, right? So what can local systems be doing to empower them again to play that important role?
Well, Lori was a pediatric nurse practitioner, and she was lead school nurse for the city of Spokane Public Schools. And at that time, there was a wall at the school. If you were not vaccinated, you didn't go to school. Since that time, there have been expanding numbers of exceptions for religion, personal freedom, and we are now dangerously close to the level of vaccination that's going to permit epidemics to occur. We know that you need to immunize 95% of the children to prevent measles epidemics, and we're down to 82% in the state of Idaho, and we are being followed by many other states. So we are going to have epidemics, and we need to once again empower the public health workers, the school nurses, to emphasize that you need to do this in order to partake in the school system. Um, I don't see that evolving at the current time. I see it devolving, and I'm very concerned about that.
Yeah, we all are.
Yeah.
And you had mentioned something that stayed with me, and it resonated too when I hear the stories and read the stories about your career, which is that vaccination and public health generally is an act of love. So when we think of all of your work and career, I think of community care and not just taking care of ourselves individually, but thinking about the community. So, can you talk a little bit more about, maybe this is to all of you, the idea of collective responsibility and how it shows up in what you do?
Yeah, thanks, Sia, for that. And, I think that the pandemic has, it's been devastating, I think, for a lot of us. And, a lot of trauma has happened. And we just are, I think, still really kind of coming out of that, right? And I think a lot of people feel a lot of hurt. A lot of people are sad because they lost people in the pandemic. And I do think that vaccinations and prevention of infectious diseases is really an act of love, because you think about your neighbors, you think about the people that you love, your family, your friends, right? And we know that, for example, with measles, right? This term comes up all the time, herd immunity. If we have a lot of people that are protected, that means we protect those people that are most vulnerable, right? For example, there are people who don't respond to measles vaccines, or there are people who are immunocompromised, right? For example, if people have cancer, or they have leukemia, or they're on immunosuppressive medications, and the vaccines don't work as well for them. So, how do we protect those people that are most vulnerable in our society? I've always come to medicine and public health with that intention of healing and love. And so when you get yourself vaccinated, you're protecting other people. You're protecting yourself, but also your community and the people that you love. And so that is the message that I like to bring to the work that I do. And so when people tell me, they might be, hesitant about vaccines, or they may have questions. Maybe they're not, maybe they are interested in getting the vaccine. They just need to understand a little bit more. So coming to it with humility, answering their questions, respecting the other person that's asking the questions, and then really just coming together to help each other, right? So that we can move forward and make this world a better place. That's truly how I see it. Yeah, thank
Yeah.
you.
Can I chime in there and
Yeah.
sort of meld those two issues that Dr. Luber talked about in terms of public health workers and Vivian, the community, and you put it together, get community health. And what I see really we need is it's to get to people support vaccination rates and support confidence in vaccines is a combination of trusted messengers in the community who have enough time to engage with people who have a lot of questions. And unfortunately, sometimes people say, "Oh, well, physicians really don't have the time to engage with people," and a lot of times nurses don't. So we got to think a little broader down sort of the pyramid of healthcare, public health workers, whether that's pharmacists, home health aides, other people who are out in the community and can talk to people at length and repeatedly. And I even expand that sphere to things that people don't think about as those who should be engaged in health communications primarily. Uh, the clergy, barbers, hairstylists, they've actually done a lot of good work around diagnosing skin cancer because they're looking at people's heads. But just all sorts of people in the community, coaches, baristas, anybody who can have time to talk to people and are trusted in the community about what the importance of vaccination is and why it's important for the community. And of course, plug my book again. This is for just the ordinary person who's trying to talk to the other people in their community they know. And the existing relationship makes them a trusted messenger. So I think we need to think, downstream about how to foster these communications in an ongoing way, not just one-hit messages. And I know we're quite close to time.
Great.
Thank you.
It's a great point. Those are really great sort of ending things to take away. I know we covered a lot of ground today. I think there could never be enough time actually to cover all of these massive issues that are sort of pervading every aspect of our life and our healthcare. But I really want to thank you all for your stories, the information you shared, and your wisdom through decades of work that you've been performing. The challenges we're facing are real, and it's paradoxical because we have all these solutions at the same time on the technological front, on the education and communication front. So I think today reminded us of the power of knowledge, empathy, and community. So I thank you all for your time, and we'll say this is to be continued.
Yeah. Thank you, Sia. Thank you,
Yeah.
Steve,
Pleasure
Vivian.
Yeah.
listening to
Thank you.
Vivian and
Thank you,
her
everyone.
stories.
Yeah.
Good work.
Yeah.